Thank you for allowing me to be a part of it.
Thank you.
Thank you.
Be well, everyone. Thank you.
Thanks, everybody. Great working with you.
Thank you so much.
Thank you,
Bye.
everyone.
Thank you to our first panelists for their wonderful discussion, and thank you to our audience members for all the questions you've submitted and your engagement in the chat. And before we move on to our second panel, again, would just like to make sure everyone is familiar with all the different Zoom functions to make sure that they can engage with our panelists, respond to the discussions that they're having. So if you are interested in submitting a question, please go to the button at the bottom of your screen, the Q&A button, to submit those questions. And they'll take a few questions at the end as time permits. And feel free to upvote them, any particular questions that you find very interesting. And if you use the chat function on the side, there have been a couple of people who've been submitting comments, but please make sure to change your settings in the drop-down box so it's being shared with all the other attendees as well, and not just the panelists. And with that, I'd also like to again thank our sponsors, Mazars USA, LLP, Citron Cooperman, Grassi Accountants and Advisors, Jeffrey Sobel Consulting, Locked-In Companies LLC, Marks Paneth Accountants and Advisors, Paymerang, Revis Page Jump LLP, Roberta Katz Consulting, and Butchbinder. Also feel free to change your settings in the top right corner of your screen if you'd like as well. And with that, I think all our panel 2 panelists are ready to start. So with that, I'll introduce them. Our second panel is Importance of Operational and Financial Health of Your Organization. And the panelists will be participating in this discussion are David Woodlock, President and CEO of the Institute for Community Living, Donna Lieberman, Executive Director of the New York Civil Liberties Union, Jennifer Jones-Austin, CEO and Executive Director of FPWA, Ethan Kahn, Partner of Not-for-Profit Practice Leader, and Merland Hector, Manager at Mazars USA LLP, Roberta Katz, Nonprofit Finance Consultant with Roberta Katz Consulting, Matthew Kirkpatrick, the Vice President of Business Development at Paymerang, and Keith Mulville, Vice President at Locked-In Companies. And with that, I'll leave the discussion to David to start out. Thank you, everyone.
Well, thank you all. Appreciate it. That was for those of you that were part of the first panel, it was a great discussion that was, I think, particularly focused on leadership, and we certainly heard some wonderful examples of leadership during that course of that discussion. This panel, I hope, will focus a little bit more on operational and financial well-being and best practices and things to consider as we all try and navigate our way through truly uncharted territory here. I mean, I think as we begin to think about all this, a couple of the things that certainly come to my mind are how many moving parts there are today and how many things there are to consider in a sense all at once. Often it feels like we're busy and there's an awful lot to do, but typically it's a good deal more linear and one thing at a time. These days it feels like about 25 things at a time. So as we consider ways to make sure that we're doing our best by our organizations and our clients, what are some of the things, what are some of the best practices, and how should we be really thinking about some of these things as we go forward? Because the truth is, most all of us have adapted in one way or another, well or poorly. I hope everybody well. My fingers are crossed for my organization. But there are ways to be thinking about that that may or not be more successful, and I certainly took some notes from the first panel as well. So what I thought we'd do is I think I'll ask if that's all right with our panelists, is ask one real general question that any of you can feel free to weigh in on. If you'd sort of give me a sign who wants to weigh in on that so we're not all talking over each other inadvertently. And then maybe ask some specific questions from your particular vantage point about the ideas and thoughts that you might want to offer our audience. So the first question in my mind is, having listened to the wonderful leadership ideas and and all of that. We all have doors to keep open, trains to keep running, and things to make sure we're all as organizationally safe and sound while we worry and try to do our best to take care of our clients and our staff. But how can not-for-profit executives and advisors really identify what matters most right now? Because with all those moving parts, there's certainly an awful lot of things that we could all be grabbing onto. But what are the 2 or 3 most important things that people ought to be considering as we think about financial and operational health? So if that's all right, maybe I'll go right across the top of the screen here. Roberta, you want to take a first crack at that?
Yeah, I'll take a first stab at this. I think what I've heard over and over again from nonprofit leaders and workers is the issue of cash. Cash seems to be the major issue, maintaining a financial stability of an organization, making sure you have money to meet payroll. So, what are best practices? Everybody's trying to generate new revenue streams, maintain the revenue streams they have. So I think the biggest challenge from a financial point of view is not only concentrating on bringing in cash and fundraising, but also the issue, and we'll talk about this more further, is, an operational health and making sure you have the processes in place to protect the assets that you have. So, as this, the topic of this panel is financial health and operational health. So I think the two really need to go hand in hand. You can't have financial health without having operational health, because you could have the greatest resources in the world, but if you don't have the proper infrastructure to manage those financial resources, it won't ensure your financial sustainability. So I think that is a big focus for organizations now, and it certainly should be.
Jennifer, go ahead.
Glad to be here and glad to be with all of you. Completely agree with Roberta. I would add that when COVID first hit, I was immediately reminded of words that my father would often recite. He was a leader and a great leader, and he would say, good leaders control for the consequences they intend. Great leaders control for the consequences they intend and the ones that they don't. And what that helped me to appreciate is that in the moment when COVID first hit and things began shutting down, that my instinct was to deal in the moment with what was just before me. But I had to think about what also might come down the pike. I had to be ever mindful of, this may not be just for the next 6 weeks. It may be for the next 6 months. It could possibly be for the next year. So when making decisions about the day-to-day operations, I had to do so with the mindset of what I could afford in the moment, but also not overpromise and overcommit for what might happen in the next 6 months or the next 9 months. So matters like staffing, that immediate thought, well, can I maintain the full body of staff for the next 6 months to 9 months? Let me tell them what I can do, what I can commit to for the next 3 or 4 months, and assure them that I will continually revisit. Doing that immediate budget reforecasting to look at where we could, contain costs, where we could save and pull back, where we could slow down expenditures, but not necessarily turn the valve completely off. So the importance of making decisions in the moment, but being ever mindful that decisions we were making in the moment could have longer term consequences, and really trying to control for that.
I think that's, Ethan, 1 second, I'll get to you. I think that's a really important point, because, the truth is, and we've probably all been through crises or catastrophes of one sort or another, the prolonged nature of this, I think, is really unique. We can all do almost anything for a little while, and people rise to the challenge, and things get done, probably, if we're all telling the truth, magically under crises rather than planfully. In the U.S. military, there's a lot of discussions about the, 2 minutes after a battle starts, your battle plan goes to hell. So we can all make do in the fog of war. I think we're in a really unique situation today. And that's why I think those key metrics and key considerations right now become so important. So Ethan?
Yeah, it's a really interesting question, and the points that were brought up thus far are really terrific. I think it's also important to realize, amidst all the challenges that we're facing, that there's also unprecedented value add to the organizations as we've all responded to these challenges, and to hold on to those values, such as updating processes and policies, creating new relationships between organizations or within the organization, revisiting some of the items that we haven't visited in the past, such as policies and procedures. And one particular item I probably would recommend to organizations is to focus on the relationship between non-financial metrics and financial metrics. For operational and financial health, we kind of have to give it an equilibrium. And we kind of have to look at the relationship between the dollars and cents that we have on our financials, our internal financials, our ongoing general ledger numbers, as well as what are we doing in program? What did we do last year? How does this loss or this new funding mechanism affect what I'm doing actually in program? And how do I maintain that program going forward? Now, we've seen programs that have actually excelled and grown, and others that have met much more serious challenges. And so that's one particular area I think I would focus on as a nonprofit leader. Try to get, what are the metrics I do have for non-financial? And that would be like a number of individuals serviced, number of units serviced, number of locations. And then relate that, constantly corroborate the two to ensure that you have accurate information and that you're keeping a pulse on what's actually going on throughout the pandemic.
Great points. And I think, as we go along, we ought to revisit that question, because I think so often in these kinds of discussions, the focus is on how do we avoid something bad happening, rather than thinking about what are the opportunities that are in front of us. So Matthew, you've been nodding your head a lot.
Yeah, just real quick, and I think Donna's going to go after me, but I was just going to say something along the lines of that opportunity, because I think it's given us, not just for organizations and nonprofits, but also as a society in general, we can stop and say, why have we been doing this for 20 years? Or why have we been doing it this way, when it's kind of forced us to look at some operations and say, well, we can do it in a much more effective and efficient way if we open our minds and look at some other options. So I think there are some positives to come out of this. We just need to keep an open mind and know that there's solutions out there that are going to make us much better and run more efficiently.
Yeah, we've the pandemic has had sort of a cycle to it, and it seems like it's revisiting us a bit. But a month or two ago, we had started some questions about people returning to our central offices, those folks that had been working remotely. And, is it time for people to come back? And frankly, I was asking the question, why are people coming back? If they're getting their work done effectively, do they need to come back? And do we need to have all this floor space and all the rest of those kinds of questions? So there's some really fundamental kind of questions for us all to address. So Donna?
Yeah, and I can't wait to get into a juicy conversation with folks about what does the post-pandemic office look like? It's
just like this. Yeah.
Oh, I hope not. I hope not. I love my apartment, but just one other dimension to add, and I appreciate what Jennifer said and others. The one sort of add-on to all this that I would weigh in as we think about how we move our mission forward, whatever our respective mission is, how we ensure the sustainability of our organization. Some of us have cash issues, some of us don't, some of us have turnover issues, some of us don't. But protecting the sustainability of the organization is critical. And for some people that means merging, I imagine. But one aspect that I think was kind of not new, but took on a new dimension for us is the importance of transparency about what was going on for everybody. I always think of myself as somebody who shares everything with my board, with my staff, not with the public necessarily. I mean, I used to share everything, but now I really share everything. And it's been so important for our staff to know, even what we're thinking before it's fully baked. And of course, that means to have some input into sort of like, how the baking goes. And that's everything from like, we don't know what's going on. We don't know what the future holds, but also like, tell us how you're feeling and how can we help you and how can we support you? And is this fair? And is this equitable? I think that we've been forced, the pandemic and this remote craziness, I still think of it as craziness, cuts off our ability to have those water cooler conversations, our ability to see somebody's face, even when we weren't looking for it. So you have to sort of go out of your way to think about how people are feeling, who's being silent, who's not showing up, or who is showing up. And so I think this, I put this all into transparency and also letting people know in concrete ways that you're thinking about them, that you care about them. To me, our staff is the heart and soul of the organization. And so protecting them and not worrying about, sort of like the output. My staff does their work, but just, I worry about the output, but we have work to do. We have a mission, but really sort of that connection, figuring out how to make that connection is really, really important.
Can I just quickly jump in and just add
Sure.
something to what Donna shared? I really appreciate Donna centering on the staff. One of the things that we sometimes do not talk about when we talk about the operational and financial health of organizations during this time is the anxiety that the staff experience when they see that the world is just, kind of falling apart, and they're seeing here, there, and everywhere that industries are, essentially crumbling, that they're shutting down. What does that mean for me? What does that mean for me in this nonprofit? I'm here to do the work. I'm very much committed to the work, but am I going to come into work tomorrow? Or am I going to get on a Zoom and be told that I'm being furloughed or I'm being laid off? And so what we found was very, very important. Again, I appreciate Donna mentioning this. I had to be more transparent about the budget and the finances and the cash flow than I had to be, in times past, because anything that I said that, suggested we weren't going to do something the way we'd done it before was like an alarm was going off. Oh my goodness. I said to staff, we will, we are assuring you that we're not going to lay off or furlough anybody. We're not going to make any decisions of that nature. We're good until October. Now, I thought in March that said to people, I'm good. I don't have to worry about this for 6 or 7 months. What I then began hearing was, she's going to lay us off in October, like, the axe is coming then.
Right.
And I was trying to give them a sense of comfort and stability for the next little while, and they actually heard it differently.
Well, I think we're probably a lot of lessons around from trauma theory in all of this, right? For those of us that are clinicians. And I think, one of the things that I've heard both in the first panel and from you all already is this notion of learning together. Whether you call it transparency, whether you call it surveys with your employees, and trying to figure this out together really strikes me as something that Kay as a New York not-for-profit media wants to think about, future events. I think models for learning together in very unique circumstances might be a really interesting way to think about doing that.
I just want to jump in and mention one thing about the togetherness, because I'm a finance person. but I really feel very strongly that, and I've been on strategic planning committees, and when financial decisions are made, let's say about program sustainability, you also need to have program staff at the table, because they would always be responsible for making a presentation on what the program does, what the resources are available, and really giving you insight into, whether or not in the decision making of whether to maintain programs, they come with a different perspective. So the organization needs really to act together. Finance cannot act in a silo. It needs to be senior management with finance, with program, together making these decisions and all speaking with one voice.
And solving, if I might add, making sure you're solving the same problems.
Right.
Because those problems can look very differently depending on where you're sitting in an organization too.
Yes.
So Keith, do you want to, now that the sun's not in your eyes, do you want to weigh in on any of this?
Appreciate you noticing that was brutal. Yeah, just what comes to mind from my end, and we serve nonprofits. We do insurance and risk consulting, so we've kind of been at the table with them through 8 months of some really difficult times. And what comes to my mind is just nimbleness. And we've had to be nimble, and our client teams have had to be really nimble and learn new ways to go about things. What we're also experiencing in my line of work is a lot of headwinds coming at nonprofits as it relates to risk and insurance. Prices are going up, limits are coming down. It's just another, death by 1,000 cuts. So really what we've learned is just we have to be very proactive with our clients. Things that used to take 2 months are taking 6 months to get through. And we're also seeing much more board involvement in our work than we've seen before. When limits of liability are coming down for organizations, boards that traditionally haven't been involved in the risk and insurance decisions all of a sudden are very involved and interested in what that means for them. So just being nimbleness and really proactive in communication is really what we've leaned on.
I would agree. So a couple of panelists specific sort of targeted questions, but the rest of the panel really should feel free to weigh in as we've been doing, because I think that's been really a fruitful discussion. But Jennifer, if that's okay, if I start with you, you all have an interesting sort of niche in all this, in that your work is in great part in supporting other not-for-profits who are providing services. So what factors do you think not-for-profits really need to be thinking about and considering to ensure financial and organizational health during all this?
So for those who aren't aware, I am privileged to lead FPWA. It is a social policy and advocacy organization with better than 170 nonprofit, human service, and faith-based organizations that provide direct services, singular in nature, and then some that are multi-service organizations, providing everything from childcare through elderly supports. And one of the first things that we had to appreciate was that with COVID, the individuals, as we all know, most impacted by the disease were the people that these organizations were daily serving and supporting. And the need was only growing and growing. We had to think about being an organization that is centered both on policy concerning the most vulnerable and on helping the nonprofits who are delivering services daily, how to balance. Should, the resources and the funds available to us, and how to do so while actually also not competing with them for resources and support. So in this moment where everybody's tightening the belt, should we as an institution be out there competing for dollars at a time when we understand that the nonprofits who are serving people are facing real immediate financial needs in just trying to keep their doors open? And so we had to think about, how do we help them in that regard? And if we were going to fundraise to support their efforts, their on the ground in the moment efforts, and then try to cut back while not really damaging or weakening the work that we were doing in the policy space. And so we were, at the very beginning saying, okay, we want to support the nonprofits that need help. Tell us what you need, and then we're going to go out there and try to fundraise for it. an example that I can give for you right now is so much of the needs of the nonprofits have centered on PPE equipment, on helping to address food insecurity, emergency financial assistance, health supports, mental health supports. So we've tried to raise funds and help support those efforts. But we're now seeing nobody has been centered on the growing education achievement gap for the children who've been at home. They may have had technology, but they didn't have the additional supports that they needed. So we're doing this kind of push and pull. How do we keep making sure that the immediate needs to keep people safe and warm and healthy are being addressed? But let's also figure out how we use the resources available to us that are not competing to focus on those other long-term issues. So it's been this balancing act. And I guess that's what many other institutions are doing. We're just trying to do it while understanding that all of what we do is important, but some things in the moment are more immediate and critical, and some things have to be engaged with the longer term perspective and eye.
We'll come back to that because I have a question I sort of want to pose to all of you as we get down the road a little bit too. I also think that that's a real challenge when every day when you pick up the paper, there's another example of some group of individuals, kids. This morning you may have seen kids with special needs who are just not getting close to what they need, and it's very empirical. It's not just they're not getting their needs met. It's the number of hours that are in their IEPs are not being provided them. And boy, I think I know I feel challenged to, okay, what are we going to do about that? And you tearing off to solve some other great challenge in life, and trying to keep that balance of, and that's really what today's discussion is about, those operational realities sort of in focus while you're trying to solve the world's problems. So anybody else want to weigh in on what Jennifer was just talking about? Okay, good.
No, I just wanted to chime in on that.
Sure,
point.
go ahead, Rebecca.
Very good, because it's the push and pull. And that's why, from a finance perspective, you're constantly doing these scenario plannings. Like, let's say I devote this amount to this bucket, how much will that bucket get? So it's like a balancing act. So, in a big way, having accurate, we talked about the financial data and having that available and timely and, transparent to all is very important so that you can kind of follow it. Some people were doing, cash flows daily or weekly, or, what scenario planning, let's do it every week because things are just changing so quickly. But at least you have a starting point and a benchmark in which you keep moving down to see, okay, if we don't have this, we have this. So at least have a framework within which to work.
Well said. Well said. So Ethan, from an accounting perspective, we've had enough time, as it were, under our belts to probably a few counting exercises have gone through their cycles. I know we certainly have here. Are there trends or things that you all have seen sort of to date in looking at the financials of our organizations that might be worth sharing with everybody so they're not repeated potentially, or that they were really effective?
Sure, David. Yeah, it's a terrific question. And just to start out, just so that the audience knows who I am, I'm the partner in charge of the not-for-profit group of Mazars USA, and actually a proud sponsor of today's panel sessions, and feel that meetings such as these with all the individuals that are involved are so helpful. Everybody's got their unique points to bring out and help each other in getting through this pandemic. A special thanks to everybody who's arranged it, to Amanda, Mindy, Kay, and all the rest of the terrific team at City and State, and to you, David. My firm in general is a firm that's got offices throughout the United States and on a certain level throughout the world. And the group that I work with, that I lead, is dedicated to nonprofits, not-for-profit sector. And such as we have the opportunity to get very heavily involved in a wide variety of missions and social services, human services, educational, churches, etc., of all sizes, challenges, and ongoing oversight issues. And that's why this session is so particularly exciting for me, because there's so much that I have to say, although I need to curb it because of the time constraints, but there's just so much to say. Before I get into my specific notes, in line with what we had just discussed, the unintended consequences of this pandemic are enormous. And you had just spoken about how you thought there'd be a furlough, or staff thought there'd be a furlough, or there were some other kind of situation. And those are just unintended consequences that we have to face and we have to deal with. And at some point have to actually switch and change what our whole plan was all about. But some of the issues I've been seeing for not-for-profits is that we've been thrown into a sink or swim mode. So sink or swim means you either have to swim through this current or unfortunately have to sink. And had we known that when we first came into this, many would have been significantly overwhelmed and probably unable to embrace the myriad of changes. So some of the items I thought I'd suggest today was around control and having a plan within our not-for-profit organization, such as crisis management and emergency management. So we've been through the crisis, we've been through the emergency, and how did we deal with it? If we look back in retrospect, what were we thinking back in March and April? And what are we thinking today? What could we have done different and for future? Disaster recovery plans and techniques. How did we deal with the disaster? We were all thrown onto Zoom. We were all thrown onto remote so quickly, so dramatically. David Garza had mentioned before, trauma on top of trauma on top of trauma. I mean, it was a great way of putting it from all perspectives. And so us, we've dealt with trauma before. We've had all sorts of issues, but this was something which was monumental. And then considering actually preparing a business continuity plan. The key is having a plan. So if we have a crisis management plan, we'll know what to do should this reoccur or should this get any worse, or even for the reentry. The business continuity plan helps us move forward into a healthy future. And that's really critical. That's a strategic level where we say, this is what I've got in my crisis. This is what I have in my disaster recovery. This is what I've learned from the past 8+ months. What am I going to do with this for my organization? How will we be sustainable operationally and financially, and actually try and grow and service more individuals and more locales? On a similar note, I would just recommend that organizations take stock of what grants and stimulus packages are out there. I've spoken to so many organizations as we've gone through it, where the HHS came out, and the PPP and the EIDL and the FEMA and just so many things, Federal Communications Commissions, telehealth, and so many changes and new grants and tranches of grants. And it's really been overwhelming to understand them, to master them, and to do them correctly. And to take inventory. What did we take advantage of, if anything, and what not? And why didn't we? And sort of be transparent, as we've all been talking about until now, with the board, to make sure that the board is on board with what we're doing and what we're not doing. Another quick area before I hand it over to Roland was that it's good to know what resources we have out there. There's so many resources, especially in the not-for-profit community, where transparency is key. As an example, many of us are into indirect cost rates from MOX, let's just say, because it's been getting a lot of attention the past couple of months. So on the federal level, there's a website called USA Spending. The USA Spending website has all the information of all recipients of all their contracts, and you actually could take a look and see, what are my colleagues doing? What am I not getting here that I potentially could be getting? And just to note, that website will be posting going forward the negotiated indirect rates of organizations. So anybody who's got a negotiated indirect rate, that'll actually become public. That'll become public information as per a new memo that came out. On the New York State level, you've got the state controller. He's got open book. You can see all the contracts on open book. And the same for New York City, where you have checkbooks. So there's so many resources to be able to use to gauge where we are amongst our colleagues, understand what's available, verify what we have if there's a slow turnaround time from the funders. That's really helpful. And one last note is some have talked throughout the day about cybersecurity, and I've seen firsthand ransomware. I could tell you the cost would range between $125,000 to $250,000 for ransomware, from what I've seen at least. I've seen organizations go fully remote, but then the server couldn't handle certain changes that they have made to it, and the server just went down, and then they were left with absolutely nothing. When they went to the IT department, they said, "Where's our backup? Where's the cloud?" IT department said, shamefully, that they didn't have anything. They thought they had, but they didn't have. And so we just need to understand, if we're making all these changes and we have all these risks, what does that mean to us? What's our plan? How are we going to react to this? And how will we not endure some of the same issues we've endured until now again? If I may, I just wanted to hand it over to Merlan. Merlan, would you have any points you wanted to share with everybody?
Yeah, sure. Thanks, Ethan. My name is Merlan Hector. I'm part of the nonprofit group of Mazars USA. I've been providing test and advisory services to the nonprofit industry for 14 years. And that being said, I just want to point out one of the things that I have noticed personally as a result of the pandemic is there are certain debt covenants that are not getting met. And as you know, the financial impact of the pandemic is becoming more and more apparent on the financial statements. I believe that some senior management members are, put in situations where, where they've met loan covenants always met them or met them in previous years, but then they were not expecting not to meet them in the current fiscal period. And we've been coaching our nonprofit clients as well as other consulting clients throughout this process about things that are needed, that they need to do in order to remedy the situation. And one of the things that, you can, do as a nonprofit client is really making sure that you are periodically, I know that some clients do it on an annual basis, but it's really making sure that you are periodically making sure that you are looking at that calculation and that it is in compliance with the ratios that you are required to meet. And if not, there are certain remedy. You can definitely reach out to your lender, the financial institution that you're dealing with, and really inquire about what you need to do in order to remedy, to cure the situation. And sometimes it might come in the form of a waiver that is actually useful for us, on the audit side. And then other times it might just be something different. And other things that, nonprofit clients can do, and I might sound redundant saying that because I know everybody is aware of maybe additional funding that has come out as a result of the CARES Act. It's really going out, is making sure you take advantage of all of the additional funding that has come out as a result of the CARES Act. I know the one that's the mostly known is the PPP loan. And I'm going to segue into my specialty, which is compliance with single audits, audits conducted in accordance to the uniform guidance. For those of you that are not familiar, and I'm guessing most here might be familiar with that, but there are special rules for nonprofit organization that expands over $750,000 in the audit period or in their fiscal year. There are special requirements for the uniform guidance. And that being said, some of the PPP funding that came through, for example, the PPP loan, the CARES Act funding, some of them, like the PPP loan, is not subject to the single audit, but some of them are. So I just want to caution that nonprofit clients have to be aware of that, of the strings attached to this funding, and they are, really evaluating and making sure that they're staying in compliance with the strings that are attached with the funding. And there are, with the single audit requirement, what we might see are that some nonprofits that have never had a single audit done in previous years have actually gone over that threshold, which is $750,000, right? So you may have been a nonprofit that never even heard about it or have never had to do it. But this is a year where you want to pay close attention to make sure that the funding that you're getting, if it's subject to the uniform guidance, that you are really, getting in touch with your auditors or consultants, just making sure that you are ready to, you already have in motion, things that need to be done to comply with those programs.
Thank you.
Very helpful.
And,
Thank you. So Roberta, yeah, I see you raised your hand. I wanted to ask you a question too. one of the things that I'm sure everybody to one degree or another is dealing with, and it came up a little bit earlier, is this whole issue of accountability and efficiency in the context of remote work. Because there probably are two, and I heard it even earlier, do you, on one hand, do you have faith in everybody that they're going to get the work done, whether it's at 2 in the morning or 2 in the afternoon, or conversely, there are others that I've heard that are doing all kinds of monitoring activities, how long people are online and those sorts of things. So I'd be interested in your thoughts on that.
Sure. First, I just want to briefly introduce myself. My name is Roberta Katz. I'm the founder of Roberta Katz Consulting, and I help nonprofit organizations build strong finance departments. I worked for 15 years in senior financial management positions at major nonprofit organizations, strengthening the operations of their finance departments. And now in my consulting business, I use that experience to give my clients the guidance and tools so that they can successfully improve the operations of their finance departments. And to answer your question, it's a very good question. Maintaining operational efficiency in a time of crisis is very challenging. But there are a couple of things that are important in terms of operational efficiencies, some of which were alluded to before by Ethan. One thing is that it's important that organizations have documented, written, and enforced policies and procedures to act as a guide for the operation of their organization. I know organizations are changing, different procedures are changing, what's being allowed, not allowed, what employees can do, it's changing. So having this policy has policies and procedures written has always been important, but it is now really more important than ever. For example, what are your policies and procedures regarding reimbursing employees for expenses? I mean, many of them are working remotely and have incurred expenses out of pocket, and now they're submitting them for reimbursement. I think, what is the organization willing to pay for? They want to buy some equipment for their house, for their home office. What is allowed, and who's responsible for approving these expenses? So I think it's very important now, even if you don't have these written policies and procedures, to at least start now, get it on paper, because then in line with full transparency, so that everybody, the organization, everybody is operating with the same, basically with the same ground rules. So that's one, method of kind of getting your operational efficiencies, especially with people working remotely now. It's more important than ever. Also, in terms of operational efficiencies, I know we've seen during this pandemic that employees can unfortunately fall ill and be out for extended periods of time, but their job has to be done. So somebody has to do it, but how do they do their jobs? So what I've done for clients of mine, and it's worked very well, is I've compiled an operations manual, which includes for a particular department, how each employee performs their job, and it covers the whole scope of the department. And this manual is put on a shared drive so that employees have access to it and can change it and update it as procedures change. So the real message is that things need to be documented now. We're in a very fast-paced environment. Things are changing. We don't know whether we'll have downsized workforces. We have to still fulfill our mission and perform daily, what we need to do on a daily basis. So it's really important to have policies, procedures, everything documented and shared and circulated to staff.
Let me just quickly piggyback on what Roberta said. I so appreciate all that you're saying, and I'm sure that incorporated in your thinking is the importance right now of, even if you have these policies and you have published them and staff are very mindful of them, this is that moment where we also need to be revisiting these policies, these best practices, because the world is ever changing. One of the things that we're doing right now as we think about efficiency is thinking about how we work and how supervisors and managers and leaders are managing the work. Are we holding people accountable to every specific, task? Or should we be managing to outcomes? Should we be managing to key deliverables? Should we be expecting that everybody's in front of their computers for 7-8 hours a day and we're clocking every minute. We've got some little chip on their system that's clocking how they're working. Or should we be saying, we need you to be accountable for this product or this report by this date, and really managing to that. And so I just wanted to add that it's making sure we have them, but revisiting them in this moment.
Yes, and you know, everybody's playing with the same rules, and then with uncertainty and anxiety, and you know, you might be speaking to an employee and they say, well, why are you calling me out? But again, if you've got things circulated and on paper, I mean, you know, it's flexible and fluid, but at least it's something, it's a document that people have to refer to. And one other point, because I know time is running short, in terms of operational efficiencies, I think organizations that have really been challenged during this pandemic are those that have processes that depend primarily or completely on paper documents. For example, invoices from vendors or purchase orders, and they do not have automated systems. But I think that this pandemic has expedited nonprofit leaders' thought process in terms of moving to automated systems, because now I think it's no longer like, you know, maybe we'll have it, it'll be nice someday. I think that day has happened now, when you can actually have vendors submit their invoices right into the software, and the whole process goes from beginning to end, right until it gets paid and you know, recorded in your financial records. Everything can be done by sitting at your computer. I mean, the money investment, it is a significant investment, and I've implemented systems at nonprofits myself, so I know it's extremely time consuming, but if it's done right, once they're up and running properly, it really saves money and time. So I think in terms of operational efficiencies, organizations need to really rethink, and I know Matthew it would agree with this, you know, the automated system is really important now for organizations that, you know, have the resources to do it.
I think that's a great segue, Matthew. I know you all focus a lot on organizational efficiencies, particularly in back office functions. Can you talk to that for a minute?
Yeah, sure. It's thank you for that, Roberta, and it's a great follow-on from what you just said, Roberta. So yeah, my name is Matthew. I'm the VP of Business Development with Paymerang, and what we specifically do is I help nonprofits with the efficiency piece of their accounts payable. So basically, I give nonprofits remote access to their accounts payable process, and then we move them off traditional payment methods into more of an electronic payment system. So what we do is we take on all the liability and responsibility of making payments on your behalf for nonprofits. So what it does is it really lightens the load of nonprofits, and obviously with the current climate, there's been a huge benefit to our clients, because they no longer have to get bogged down with the minutiae of some of it, and they let us handle it. But the nice thing about it is, you know, we're making them more efficient, more secure, but also more profitable, because we have a unique business model where it's a self-funding situation. So our clients don't pay us any money for our services, but we're able to share our profits with them. So it's just a nice little cherry on top of the ice cream, so to speak. So not only are we lightening the nonprofits load, you know, I think Jennifer mentioned about tightening belts. There's this myth that if they use a company like ours, that it's going to cost them money. It's actually not going to cost them anything. Make them more efficient, and then share some profits with them. So it's kind of a win-win situation. So we really found that lightening the load allows staff and people to focus more on the mission, and really kind of, you know, dig a little bit deeper in what they're trying to do, and not kind of, like I say, get bogged down with some of the day-to-day mundane nature of accounts payable. So it's essentially letting the experts take care of it for them. So it frees them up to do more strategic tasks. So
That's great. Thank you, Matthew.
And I'll keep it short and sweet to give all the people some time.
Yeah, appreciate it. Thank you. Thanks. So Donna, you mentioned earlier just about sort of some of the challenges with new services and keeping the core mission kind of moving forward. I'd be interested in hearing your thoughts on how did you sort of get your folks to sort of stay focused on getting the mission done?
Yeah, well, I wish I could take credit for it, but I can't. What I can take credit for is putting together a team that is, you know, deeply committed to the mission of the New York Civil Liberties Union, which, by the way, is the New York affiliate of the ACLU, And our work involves litigation, lobbying, advocacy, communications, to protect civil rights and liberties. And I said that half in jest, that it's not me, it's my team. I found that what was strong going into the pandemic kept us going through the pandemic so far, and the weaknesses became and we just really had to sort of address them. And so that's challenges and silver linings. I think that I would say that the last 8 months have been a perfect storm of constantly changing challenges and trauma for all of us and for all of our staff. So the most important thing has been, I think, acknowledging that and acknowledging the need to be mindful about the organization and enlisting the support of the entire staff in the mindfulness, in the commitment to the organization, and in the importance in recognizing the importance and their role in being able to pivot as needed. And so, for example, in our budgeting process, we had a budget that was due March 30th. Who knew what our finances were going to be? So we just adopted a 3-month budget, continuation budget, and revisited in June when everything was like not exactly crystal clear, but we had a better sense, so getting comfortable with the discomfort of not knowing was really important. But, we deal with issues. And for the first few months of the pandemic, we were so focused on the legislature and also making sure that our staff could keep working from home and adapting schedules and making sure that everybody knew you will never have to go into the office unless you're totally comfortable with it. It's your call. We're going to make it fine work for everybody. And we did. And then, here we are. One of our mottos is protecting protest, right? And Black Lives Matter. And this is a core issue for us. We're about equity and equality and protecting protest. But we just told our staff that we want you to stay safe. So how do you pivot? How do you acknowledge the vulnerabilities and the passions? And it's really, the answer is that there's no right answer, but conversation, recognizing that we all are in this boat together, and we need to figure out what our lane is, what other people's lanes are, so that we don't tread onto them, and sort of where people's comfort levels are. And so I think that's been really pivotal. And the silver lining to all this very messy, several months, is that our staff feels appreciated, which is very cool. But as important, if not more important, is that they feel bought. I think the staff is bought in, not just to the mission of the organization. A lot of folks think, I love this organization and I know what's best. And my politics are what's best for the world and the organization. Actually having a common sense and a common understanding of where we should be going. I mean, we'll never have we're not homogeneous by a long shot. We're organizers and activists, but I think we have a much better sense that we're all in the same boat together. And that's been really powerful for our work.
Yeah. Well said, well said. So, on a real practical level, Keith, one of the biggest expenses that any of the not-for-profits have is their insurance costs. And as we've heard really all day, the ambiguity and what's moving and what's not moving and what can we anticipate and those sorts of things. Can you share with folks sort of where you think the insurance industry is headed so we can be as thoughtful about our planning as we can?
Yeah, thanks, David. It's candidly, it's in a pretty tough spot right now. The insurers don't like all the economic uncertainty we're seeing. Losses are up. It's just a bad scenario. And I hate to share that news with nonprofits who are struggling with all these very real issues. And then you add one more on top of it. But I would just say, now's really the time to challenge the advisor that you're working with. Now's the time for some creative kind of outside the box thinking. And I think many of us that work in corporate finance and touch insurance, we've kind of, for 10, 15 years, it was kind of just rolling over, very mundane, not a whole lot of thought to it. But now's the time to kind of, again, just look for some creative solutions. We're looking to balance, operational and financial efficiency. So organizations are going to need to get comfortable with less coverage, probably. They're going to need to be smarter about that. Insurance is all about just the efficient allocation of capital. And if you've had certain limits for the last 5 or 10 years, it's probably a good time to kind of reassess where you are. Maybe you don't need that much protection. Maybe we can accept a little bit more risk and divert some of those funds back towards the mission and actually, doing what you set out to do.
A great observation. Increased risk, huh?
That's 2020 for you.
Yeah, isn't it though? I guess as we sort of get to the end of our time, I'd really be interested as we think about sort of the next 6 months, because we're probably all looking at least another 6 months of this. What would be the pearls of wisdom that you might offer the 150 or so people that are listening to you right now? What might be the pearls of wisdom for Jennifer? I think you used the term anticipatory planning for the next 6 months. So since you coined that good phrase, Jennifer, I'll ask you to start that off. You're on mute.
I couldn't hear the last part. You trailed off.
What would you, what pearls of wisdom would you give folks as we think about trying to anticipate what the next 6 months are going to bring us all? What 1 or 2 pearls of wisdom might you offer everybody?
Pearls of wisdom. Oh goodness, I wish somebody would give me a whole string of pearls for this.
Me too.
I think the being flexible, being adaptable, appreciating that you don't have all the answers, but trying to be planful, thoughtful and planful, centering on what is your mission and how you've been proven to be most significant in this moment, and then running with that. So planful, thoughtful, adaptable, and flexible, while holding true to that which is your sweet spot in this moment. Great. Easier said than done.
Yes, but important nonetheless.
David, if I could add to that, just my
Sure.
My observations over the last 8 months is it's all about the people, our people. And, one of the reasons why I love working with nonprofit organizations is they've always been so committed to staff. But that's really the name of the game these days. We've had to learn to be flexible with people, let them do their work, just trust that they're going to do the work and take care of things. And the hours may be different and it may look a little bit different, but just trust your people are going to take care of your people and they'll take care of clients. So I think it's just really all about taking care of your people right now.
And David, I think also collectively, we need to lean on each other in society, because I think there's a lot of good people out there and good organizations who can help you. And I think Keith mentioned this earlier too, is like, we have to be creative, keep an open mind and think outside the box and do things maybe slightly differently, but it doesn't have to be scary. It doesn't have to be like fundamentally change anything. It's just a different execution of certain procedures, which can certainly set you up not only for the next 6 months, but the next 6 years as well. So I think it's important to be open-minded about things.
It's a real theme there, isn't there, about adaptability. And Don, I think you used the word earlier about being comfortable with ambiguity. And I think that's absolutely true, because you can be uncomfortable about it, but it's not going anywhere. So
yeah, and I guess I would add to that, sort of like being comfortable with imperfection. We live in a country that is built on imperfection is like the wrong word for it, but that's built on inequality and disadvantage, back to slavery and through the current time. And, you know, as we emerge from the disastrous last 4 years into a new era of building, you know, a country that doesn't hate each other and doesn't hate difference or strives to that, I think we have to, like, you know, hold each other. You know, we have to sort of like have a mantra of dignity and respect, caring about, you know, we talk about it in terms of our staff. You know, we have to give people the benefit of the doubt and thinking about how are we part of the solution and how can we sort of like throw, you know, sort of like the bad parts of